That's a sound Lee Wickenheiser hopes he never has to hear for real. He's testing out the LifeCore vest, an external defibrillator designed to jump into action should his heart go out of rhythm. Lee has had his share of heart problems, including a quadruple bypass more than 20 years ago, as well as follow-up surgeries for stent placement. But a recent heart attack has left him especially vulnerable.
This is a transition point until they deem my heart strong enough to be on its own. That should I get a slight attack in the future, that my heart would be strong enough to handle that on its own until I could obtain medical attention.
And what it does is it regulates the patient's rhythm. It sort of monitors the patient's rhythm all day long for 24 hours a day, and it picks up on lethal rhythms and shocks the patient if they have a lethal rhythm that may ultimately result in sudden death.
In many cases, patients at risk of a heart attack require surgery to implant a defibrillator. The problem is there's a 3-month waiting period to safely implant the device.
Most of those patients have their lethal event during that time period when they're waiting to get their implantable defibrillator. And that's where this device comes in and is a brilliant idea.
The vest consists of 2 main components: an electrode belt and garment that surround the patient's chest, and a monitor that the patient wears around the waist or from a shoulder strap.
It's like putting on your shirt every morning, you know. It's just, you know, I take it off once a day, I take a shower, I put it back on, and you don't even know you have it.
This high-tech helper has even developed quite the doctor-patient relationship.
The device actually talks to the patient. It will tell them we're detecting a rhythm, or there's on the back an electrode that begins to vibrate, which indicates you may be in a lethal rhythm.
Treatment stopped by response button. Bystanders, do not touch device.
The patient then presses a button, it's transmitted to a satellite, the satellite transmits it onto the web, I get a phone call, and I can go to any computer, get on the website for LifeCore, and look up exactly the rhythm that is occurring at the time or that the patient has triggered. I can call the patient right away if the device has not gone off and give them instructions.
If a lethal rhythm causes a patient to lose consciousness, LifeCore shocks the patient's heart back into rhythm and delivers instructions to those nearby.
Do not touch patient. Call ambulance.
It may be just a temporary tool, but the effects are long-term.
For me personally, it saved the lives of 3 of my patients who, had they not had this external device, wouldn't be here now.
As I was walking around without it, I would constantly be wondering, at what state am I? And be thinking about it all the time. Doesn't even cross my mind now. My family's mind, they like to make sure I got it on. You know, especially my wife. She makes sure that I have it on, and that's a great comfort zone for her, for sure.
It could prove to be a life-saving part of Lee's wardrobe. And that will never go out of fashion. For Smart Medicine, I'm Rod Starnes.